On to the fun part of today's show now. We have an next special guest. We have Professor Niro Siri Wardener from the University of Lincoln. We'll be discussing calls for ambulance services to roll out the green whistle. Hello, Professor. Welcome to the show.
Morning, Danny. Good to meet you.
Yes, it's nice for you to be with us on the show. We're talking about this new thing. Well, it's called the green whistle. It's a pain relief. And can you just tell my listener more about it, please?
Of course, we've just completed a study. That's a study done by the University of Lincoln and East Midlands Ambulance Service, evaluating the effects of this particular drug that's delivered by a whistle. And the drug is called methoxyflurane or Penthrox, and it's inhaled through this whistle or mouthpiece. And it's for adults who have got pain due to trauma or injury. And as you can imagine, people who might have broken a leg or involved in a road traffic collision or had a burn, they're often in quite severe pain and need pain relief very quickly. And we found, comparing this particular agent when used in an ambulance with the existing drugs like intravenous morphine, intravenous paracetamol, or Penthrox, that it relieved pain much more quickly, twice as quickly compared to morphine, and 3 or 4 times more quickly compared to intravenous paracetamol or Penthrox.
Thank you very much. And does this Penthrox, does it have any side effects?
It does. We looked at side effects in our particular sample of 460 odd patients, and we found that around just under 7% had side effects, so 32 patients out of 479. And the sort of side effects they got were cough, altered taste, nausea, feeling a bit funny or dizzy. Those are the sort of effects, and they wore off very, very quickly once people reduced taking the inhaler, or in very few cases they stopped taking it. So the side effects were mild and didn't affect many people.
Thank you for explaining that. And also, I wanted to ask, how long does methoxyflurane provide pain relief for?
Okay, so you take it through this whistle, and essentially it works while you're inhaling the agent. But actually, the inhaler will last for the duration, at least, of the ambulance trip. And we found that on average, it had a maximum effect around 26 minutes. So it reduced pain from severe to moderate in 10 minutes and had a maximum effect around 26 minutes. That's compared to morphine, which reduced severe to moderate pain down to moderate in 20 minutes, so twice as long. And it took 40 minutes or thereabouts to get a maximal pain relief. So essentially, it lasts for the duration of the ambulance trip. And some emergency departments also use it, so they can continue to use it when somebody gets to the emergency department.
Thank you. And Penthrox or methoxyflurane, what countries has it been used in? And currently in the UK, where has it been used? And would you like to see it kind of rolled out further afield?
Well, it's been used for around 40 years in Australia and New Zealand by paramedic and emergency services over there. But ambulance services here have delayed using it because it's been relatively recently licensed. It is used in many other countries as well, but many services have been interested to see the results of this evaluation before using it. They want to see how it compares with existing agents, how effective it is, what the costs are in comparison. So it is starting to be used by ambulance services, and obviously our job is to present the results of our evaluation and then let ambulance services decide when or how to implement it.
Thank you. And in my notes, it says it has been proven to be more convenient and an effective pain relief option. Does this mean it can lead to patients spending less time in accident and emergency departments? And additional to this, it's also self-administered as well.
Yes, absolutely, Danny. So the fact that it's self-administered means that people have a little bit of control over it, which is great. Obviously, you don't need to give it by injection, so you don't have all the paraphernalia of putting a drip in or a cannula to administer it. So it's quicker from that point of view. It helps, obviously, people's experience of pain, obviously at home and getting onto the ambulance. We know that it speeds up care in the emergency department from a study done at St Mary's Hospital. So there are lots of benefits in those respects. The other thing about the ambulance setting is that to be able to give an injection like intravenous morphine or paracetamol, you need to be a paramedic. And many ambulance services also have technicians or emergency medical technicians who can't give intravenous drugs, but they can give Penthrox or methoxyflurane. So I think that is an additional advantage. And about half the ambulance clinicians we trained in this study at East Midlands were emergency medical technicians.
Thank you. And you mentioned your collaboration working alongside the East Midlands Ambulance Service. Can you just tell my listener a little bit of the types of work you do alongside the service?
Okay, so I also work as Associate Clinical Director at East Midlands Ambulance Service, as well as my role at the University of Lincoln as a professor. And my role is largely around research in the ambulance service. And we've worked with the research team at EMAS, East Midlands Ambulance Service, and have done a whole range of studies into conditions like falls, stroke, heart attack, cardiac arrest, pain, obviously. Currently, we're looking at community first responder schemes, but we're also looking at the effect of COVID on ambulance services and the effect of the pandemic, which, as you can imagine, has affected calls and responses fairly dramatically.
Thank you very much for telling myself and the listener more about your involvement with East Midlands Ambulance Service. And you did mention COVID as well. I wanted to just go back to the Penthrox methoxyflurane. Has that is it beneficial as well to during these pandemic times to use this pain relief more than ever?
I think it's beneficial whether we're in a pandemic or not, because the conditions that lead or necessitate its use, traffic collisions, back or neck injuries, those type of conditions are continuing, and ambulance services are very busy being called to those and obviously a whole range of other conditions.
Thank you. And you did mention, of course, the NHS overwhelmed presently and in general, whatever time really, pre-COVID. East Midlands Ambulance Service receive over 1 million calls, emergency calls annually. And do you see Penthrox as a way of alleviating the substantial pressures NHS are facing during these times?
I think the most important thing is that it'll help, we think, based on this evaluation, that it'll help people's experience of pain when, particularly, obviously, adults who've got pain due to injury or trauma, which this drug is licensed for, that it'll help their experience. We know that if pain is managed well in the ambulance, that it makes care in the emergency department better, but also that it reduces the risk of longer term problems with pain, post-traumatic stress and so on, related to people's experience.
Thank you very much. And that we had on the show Professor Niro Siri Wardener from the University of Lincoln discussing Penthrox methoxyflurane pain relief calls for it to be rolled out further afield. It's been very interesting, insightful having you on the show today. Thank you.
Thank you very much, Danny.
Thank you.
Great to speak to you.
And yourself.
Cheers, Danny.